we're back here again on the Healthcare Business Network. That's hbnradioshow.com, hbnradioshow.com. We're here with our guest of the week, Dr. Brian Hines. Dr. Hines is the founder of Doctors Aiding Doctors. And before the commercial break, we were discussing what the whole concept and idea was for Doctors Aiding Doctors, the target audience, which that it is being directed to, and as Dr. Hines mentioned to us, it's really being directed to primary care physicians, and we discussed how the program worked. The question I wanted to ask you, Dr. Hines, was, are there different subscriber levels, and if there are, what are the costs involved with subscribing to Doctors Aiding Doctors?
Sure. So we wanted to make this as accessible and as simple as possible, and so there's one membership level. That the cost for a 1-year membership, which is, inclusive of all the education that we spoke about, as well as inclusive of being able to ask those individualized questions, is $500 for a year per physician. And it's through those fees is one of the mechanisms that Doctors Aiding Doctors makes money. There are basically two other ways that Doctors Aiding Doctors as a company it makes money. And the two other ways, and this other one is something that I think is an exciting model, and that's that we have relationships with at least two different companies that provide the equipment in each of the different conditions that we support. And we collect a percentage of revenue for every time that equipment is sold through somebody that's referred through the website. So as the number of conditions that we support on the website increases, even if the number of physicians remains fairly static over a certain period of time, the company still has the potential to continue to increase its revenue sources.
And in that case, as long as the company is doing financially well, it can offer more and even better services to the primary care physicians.
That's absolutely. And then and we would assume that as we continue to offer more of these services, we'll be appealing to a more diverse group of physicians. The population that we serve increases, and that makes it furthermore appealing to different companies to develop these relationships with us.
Now, I'm sure, Dr. Hines, that it's probably crossed the mind of some of our listeners out there. Why would specialists want to be involved with Doctors Aiding Doctors? Wouldn't they perceive Doctors Aiding Doctors as a threat to their revenue? Because essentially what we're doing here is we're encouraging primary care physicians to go ahead and do some of the testing that has been done by specialists up to the present time. So why do specialists look upon Doctors Aiding Doctors as something that is going to help them as well?
Well, that's a terrific question. And, initially I think that many specialists, have spoken to me about this, and they've had concerns about this, and they have not initially embraced this. But what we've seen is actually something that's really exciting and that has been able to generate a lot of excitement amongst different groups of specialists, and that is basically this. For example, in my practice, I take care of women, as I said, who have urinary incontinence, who have overactive bladder, who have pelvic prolapse. And if you look at the demographics, and you look at epidemiologic studies, the incidence of urinary incontinence in the population is somewhere about a third of women over 50 suffer with these problems. The women that I see in my practice is absolutely the tip of the iceberg of women who actually have these problems. Again, these women are suffering with these problems for years and years without anybody asking them about them. Going out to pharmacies and buying these protective pads so that they don't have to talk about it. And if we could take now primary care doctors, who are the gatekeepers, who are seeing all these patients, and we could give them essentially a financial incentive to talk to their patients about these conditions, the number of patients that I see in my practice as a specialist isn't compromised by those internists doing a little bit of urodynamics and trying to diagnose someone with urinary incontinence. But my practice explodes because of all the new interest in diagnosing urinary incontinence. It's not the goal of Doctors Aiding Doctors to, again, turn the primary care doctor into a specialist who's going to definitively diagnose and definitively treat. It's to help that primary care doctor learn what questions to ask to elicit these symptoms that then lead the primary care doctor to being able to start the diagnostic process, when appropriate, start the therapeutic process. But many of these patients will ultimately need referral to specialists. So what we've seen in different communities is not that the care of the finite group of women who are presenting in that community with urinary incontinence is now being taken over by the internist. But what we're seeing is that the internist is unmasking, the much larger portion of the, proverbial iceberg, that's suffering with these problems. The internist business grows, exponentially, and the number of, high quality, if you will, referrals to the specialists really increases very dramatically. So in communities where primary care doctors have, started embracing what Doctors Aiding Doctors offers, the specialists, the practice of the specialists in those communities have really flourished.
Let me ask you, for primary care providers, what do they need to do, in your opinion, to start effectively using this tool? I mean, they go ahead, they go to the website, they sign up, pay the fee, about $60 a month. Less than that, actually, $50 a month. You said how much? It was $500 a year? It's actually less. It's about, what, 40 and change a month. So what do they need to do, the primary care physician, in order to really effectively make the best use of this tool? Because it sounds to me like it's a very powerful tool. Yeah,
that's a great question. I think the most important thing for a primary care doctor to do to really start to see a dramatic change in their practice, in their revenue stream, is to embrace the ideology here, is to really kind of delve into this and accept that they can and they want to change their type of practice. Once they sort of believe that these are conditions that they are qualified to talk to their patients about, when they start to see some benefit in taking care of their patients, both financially as well as from a patient satisfaction perspective, the tools for how to integrate this into your practice are all right there. One of the things that the Doctors Aiding Doctors site provides is personalized marketing materials for every practice that becomes a member. We provide personalized handouts that they give to their patients that support the education that the physician's providing. It's a fairly inclusive product that's intended to be very, very easy to use, from ads that the practice can download, that they can place in their waiting rooms, that they could put in their newsletters that they may send out. There are ads that we provide them that are appropriate and personalized with their practice information that could be placed in local newspapers or magazines, whatever their community does. So once the physician, once the practice really sort of embraces that, we see these patients, we take care of these patients on a daily basis, and they get a sense for how much they can dramatically increase their revenue. The tools are there, the information to teach them how to integrate this, and then all the material support to help make this a reality for their practice is all part of the website.
Dr. Hines, we're going to take a break here with a commercial break from our friends from the Chester Company. When we come back, we're going to discuss more in depth on the Doctors Aiding Doctors program with our guest here, Dr. Brian Hines.
Revitalize the image of your practice with marketing and communication services from the Chester Company. We specialize in helping you communicate effectively with your patients. Whether it's a patient handout that announces a new service or a new website where your patients can conveniently make their own appointments, the Chester Company is here to help you present your practice and its services in the best light possible. Let us show you how. Call for a free, no-obligation consultation. 860-526-9903. 860-526-9903. Call now.